Okay, so we went over some of the skin colors that could be caused by the blood. And now the thickness, the one that has the thick skin, the stratum corneum, sometimes, and it does happen as we get older, okay, that the palms of the hand and the soles of the feet can take on a little bit of a yellowish color. So that's another pigment that can show up. It's pretty much normal for that thick skin. Now, getting into the second layer, the dermis, the portion that we're going to see making these little papilla, okay? Wow. Look at everything that's embedded in this area of the skin. If we take a peek at all of these materials, all right, this is what we find. Do y'all ever think about your skin? Really? I have a friend whose daughter wants to go do that. Yeah, like if you've ever had like a facial, okay? Oh my goodness, they're so nice. All right. But you know, a lot of times the way that we tend to focus on our skincare is usually like with our face or whatever, okay? But the entire parts of it need to have skincare. In looking at this second layer, the dermis will help to give structural strength to this organ. We're going to see that we have the connection with some connective tissue. We're going to have a bunch of fibers. I really liked in that video where it was showing under the tissue repair, and I closed that site down. Oh no, I wanted to remember that video. Okay, I'm going to have to go back and try to find it. But the tissue repair, and did you pick up on the part where it was kind of like showing the collagen fibers? Okay, trying to help pull it together. Okay, I thought that was pretty cool. Fibroblasts, if you remember, those are the cells that can help give rise to fibers. For example, like the collagen. The macrophages, do you remember that in the video? The one that was eating the little bacteria. We have some adipocytes there. We've got our blood vessels. We've got nerves. We've got our hair follicles. We've got smooth muscles. We've got glands. We've got lymphatic vessels. You won't get into the vessels in part 1, but you'll definitely get into them in part 2. We get sensory functions. What this means, we're going to have sensations that can be picked up. A lot of what we think about with touch, okay, like light touch, heavy touch, pressure, all these types of sensations. Pain, itch, tickle. We got stuff that'll deal with temperature. 2-point discrimination. Now, you won't get a whole lot of that into that in this part, but you will get into that in part 2. The dermis has 2 layers. Now remember, epidermis had 5, okay? Dermis has 2. We have what's called our papillary, which I've tried to mention a couple of times because they create these papilla, all right? So we have a papillary layer, and then we have a reticular layer. So we have a superficial and we have a deep, okay? So the papillary layer is about 1/5 of the dermis. We have areolar tissue, lots of elastic fibers. It's the reason that skin can stretch and recoil, like gaining weight, losing weight. It does begin to break down if it happens too much. those dermal papilla, making, like, for example, the fingerprints. We've got capillary beds, all right? Capillary beds. This is the point that any type of exchange with the blood takes place. Okay, it occurs at a capillary bed. Our fingerprints, the whorls that they make, we have touch receptors. They're called Meissner's corpuscles. And they're in this papillary layer. And then we have some free nerve endings which will sense pain. Their goal is to send that information to be processed by the brain. In the deeper layer, the remaining 4/5, we find dense, irregular connective tissue. Collagen and elastic fibers, some adipose cells, hair follicles, nerves, oil glands, ducts of the sweat glands, and heat sensors. There's a lot more going on with your skin than you're aware of, which is good, okay? If we had to be aware of it, chances are we could pretty much probably go insane, having to pay attention to every sensation and information that the skin picks up. One of the things that's present in skin and having the connection between the epidermis and the dermis. We've learned about these cleavage lines. Tension lines is another name for them. And then striations, okay? The reason that this is important, it used to be that when surgery was done, doctors would cut anyway, okay? They would cut this way, that way, to whatever way they wanted, okay? A lot of times, the person could spend a lot of time in the hospital. They could end up getting infections, have trouble with it healing. Now that we know as much as we do, one of the things that's present are these lines. Do you kind of notice how they go this way and that way and up and down and side to side and so forth? Doctors now know by paying attention to this, when they get ready to go do surgery, rather than cutting across it and cut across several of these striae, because that's a striation, okay? This would be a cleavage line, all right? Rather than cutting across several of them, make your incision with the lines. Not only does it give a better closure, you get less chance for scarring. And so by doing this, we're not creating situations where the skin is getting overstretched, gapping open, not creating a clean scar, so to speak, okay? So doctors have learned by following these lines that get created between this dermis and epidermis, they're finding that surgeries are quicker, heal time is quicker, they may not have to cut as much, okay? I mean, I can like remember as I was growing up, you would literally have people get cut all the way open, you know? I mean, now, you say for example, gallbladder surgery. if they don't have to cut, which very seldom they have to do anymore for gallbladder surgery, now kind of do these little holes, go in with scopes, and suck the gallbladder out. Okay? Heal time is quick. Chance of infection low. Don't have to really stay in the hospital any amount of time. So they have learned lots of ways now to make surgery easier by paying attention to what we now know about the skin, which I think is great. Because anything you can do to reduce scars, for example, and reduce that ability, because did you notice how it was a gap open in between the stitches? Well, what is that doing? That is keeping that outer portion of the body open to the outside environment, letting microbes in. So we're closing it up better, reducing chances of infection. Now, in that subcutaneous tissue, now remember, this not a part, okay? This is the hypodermis. It's deep to the skin. It has loose connective tissue with both the collagen and the elastin fibers. It contains fibroblasts, adipose cells, macrophages. It's also known as the hypodermis. Sometimes you may hear it as superficial fascia. Fascia, once again, meaning a sheet of something. It has about 1/2 of the body's adipose tissue. Chances are, when you go on a diet to begin losing weight, the places that you're going to lose the weight first will be from around internal organs and then under the skin. Have you ever seen those shows like My 600-Pound Life and stuff like that? Okay, and the people who lose like a whole bunch of the weight, what happens with their skin? And then because there was, I think that was the show that had the doctor that would, they'd have to go on that diet, or no. I think they would do like the stomach thing, the stomach surgery, and then if they lost enough, he would come back and do the surgery to tighten up the skin and everything. And that's because a lot of this that was built up under the skin is now gone. Does that make sense?
Did one of the surgeries consist of making the stomach smaller?
Now, like from that show, or
I was just curious.
overall?
I was wondering, could you make somebody's stomach smaller? Because like when you eat more than you're supposed to, it stretches out your stomach.
Now, there are things that can be done, okay, for that. And I'm guessing what you're thinking about for that is the people who might go get the band around their stomach, or they may go have what they refer to as the stomach stapling, which technically is not really what happens, but that was an easy way to explain it, okay? And it makes the stomach pouch. Now, when I say that type does the stomach pouch and it does it small, we're talking tiny. The people can only eat maybe 1/4 cup of food at a time. That's how tiny it's gotten. And they have to take a lot of supplements because, it's difficult to get what the body needs from that amount of foodstuffs, okay? And yeah, it can lead to weight loss, which would affect everything else, yeah. So one of the things about this adipose tissue, it is an energy source. One of the ways that the body wants to get energy, it wants to get energy from sugars first, fats second. So the way that it can make energy is it will pull from the adipose cell.